Hey, this is Erin from Educated Nurse, and we are going to look at different types of IV fluid solutions. We're going to look at hypotonic, hypertonic, and isotonic solutions. And we're going to take a peek and see what it does to the vessel and the volume in the vessel or your blood vessel, and then what it does to the cell. So stay tuned. Okay, so let's start with isotonic solutions. An example of an isotonic solution would be normal saline or 0.9% normal saline or sodium chloride, and then lactated ringers is another example of an isotonic solution. These solutions, the solute level is very similar to our own body's composition and makeup. So when we give a patient an isotonic solution, we're not really going to be affecting the cell. The only thing that we're going to be doing is adding volume to the vascular space. So when we give an isotonic solution, like I said, 0.9% normal saline or lactated ringers, there isn't going to be much change to the cell, if anything. So when we dump it into the blood vessel, like when we start an IV and we give fluids, all you're going to be doing is plumping up the vascular space. There's going to be no change to the cell. And I want you to think about these little Fruit Loops as the cell, okay? So no change to the cell. Typically, if there is a change in solutes, we're going to notice some changes across the cell membrane. In an isotonic solution, no change to the cell is going to happen. So we're just going to be adding fluid to the vascular space. This is perfect for patients who are dehydrated or maybe they're NPO before surgery. So say your patient has nausea, vomiting, diarrhea. An isotonic solution is perfect because we're going to plump up their vascular space. We're going to give them more fluid, but we're not going to change the cell structure at all. So in an isotonic solution, you're going to add fluid to the vascular space, but your cell is not going to change. One thing I want you to be mindful of is when we talk about fluid replacement, you can't forget that there is going to be some dilution happening here. So if you think of the Fruit Loops in this container as your blood cells, the more normal saline or isotonic solution that you put into the vessel, all you're going to be doing is adding in more liquid. And so what's going to happen is as these blood vessels move around in here, if you just keep adding more liquid and don't replace the blood vessel or the cells from the bloodstream, all you're going to do is dilute that. So if you have a trauma patient that's bleeding, or someone who's even anemic, just dumping in an isotonic solution to bring up your volume isn't the greatest. Yes, these patients probably need some volume as well, especially if they're symptomatic, especially if they're hypotensive and tachycardic. But if you're thinking about getting, their volume level up, as well as considering an isotonic solution, you should also think about replacing their red blood cells, white blood cells, platelets too. So giving them some whole blood so you can add in those extra blood components is super important, because otherwise if you don't add those blood components in, all you're going to do is dilute the stores that you already have. And you still aren't going to have the effects of those red blood cells and the oxygen carrying capacity and the role of the platelets and the white blood cells. So if you are thinking about replacing fluids, if you have a trauma patient or someone who's hemorrhaging, make sure to consider packed red blood cells and blood products as well as fluid replacement. All right, so next up is hypertonic solution. So a hypertonic solution is anything greater than 0.9% normal saline. So an example would be like a 3% normal saline, a 7% normal saline, even much higher. We have different concentrations. With a hypertonic saline solution, what's going to happen is the volume is going to change within the vessel and the cell is going to change also. So in a hypertonic saline solution, the amount of salt and solutes in the solution is going to be much higher than what's in the vessel and what's in the cell. So when you dump this into the vessel, what's going to happen is the liquid inside the cells, the water inside the cells is going to be like, holy buckets, that is super salty solution. And what's going to happen is water from the cell is going to leave the cell because it's going to want to try and dilute that super salty liquid that's in the vessel. So water from the cell is going to leave the cell, which is going to cause the cell to shrink. And then water is going to pull itself into the, well, it's not going to pull itself, but proteins are going to help pull the water into the vessel, and the cells are going to shrink. And so then the vessel itself is going to fill up with more fluid. This is good and bad, right? So let's say we have a patient with increased intracranial pressure. This is a great solution to use, or increased ICP. This is a great solution to use because it's going to shrink the cells in the brain and hopefully help us decrease the pressure in the brain. It can be a problem, however, because then the patient can get fluid overloaded if they don't have a mechanism to get rid of those fluids. So in a hypertonic solution, the liquid inside the cell, the water inside the cell, is going to look at that really salty water and be like, holy crap, that's super salty. I'm going to give up some of my liquid to try and help dilute it, because it always wants to try and dilute and create some homeostasis. And so the cell is going to shrink and water is going to pull into the vascular space. And then hopefully we can get rid of it through elimination or urination. So in a hypertonic solution, again, the liquid is going to be super salty. So the liquid inside the cells is going to leave the cell. The cell is going to shrink. Like you can see here, they're much smaller than before. The cells are going to shrink and the water is going to leave the cell and go into the vascular space to help try and dilute that. Okay, so let's talk hypotonic solutions. Hypotonic solutions are going to be anything less than your 0.9% normal salines. So those would be like your quarter normal salines, your half normal salines. There are some dextrose solutions too that are considered hypotonic, but primarily it's going to be your quarter and your half normal salines. Now, with your hypotonic solution, if you have your hypotonic solution, the solutes in your hypotonic solution and the level of salt is going to be much less than what's normally cruising around your body. So when you dump in a hypotonic solution to your vessel, what's going to happen is the cell is going to look at that salt, that not as salty solution, and it's going to say, whoa, my salt content in my cell is way higher than what just got dumped into this blood vessel. So what's going to happen is your cell is going to plump up. And the reason it's going to plump up is because the salt within the cell, or the solutes within the cell, are going to be higher than what's in the vessel. So again, it's going to want to try and go through this equilibrium state, and water from the vessel is going to go into the cell to try and help dilute the solutes in the cell, which is going to plump up the cell and make the cell nice and big. The problem is, in some patients, it's going to remove fluid from the vessel. So as the cells plump up, think of it as a sponge. Water is going to go from the vessel inside to the cell, and it's going to act like a sponge, and the cell's going to expand. That's going to pull water from the vessel. So if you have a patient who is maybe dehydrated, it might not be the best idea to give them a hypotonic solution, because it could further dehydrate them. Just like on the flip side, a hypertonic solution, it's gonna pull water away from the cell and it's going to put it into the vessel. And so you have to be careful of fluid overload. In a hypotonic solution, you have to be mindful of fluid volume deficit. So you have to be careful with that. But this is a good option. Say your patient has a high sodium level and they need some fluids. This could be a good option for them because of the lower amount of salt in the hypotonic saline solution. So as you can see, with your hypotonic solution, water is going to pull out of the vessel and go into the cell, because the cell is going to have a higher amount of solute. It's going to plump up the cell, and then it's going to pull water from the vascular space. So can cause some dehydration in your patients, but just remember, a hypo is going to pull it out of the vessel and into the cell and plump up your cell. So hopefully this was helpful and you can remember the next time your patient needs IV fluids, maybe some tips and tricks so you know how these different IV solutions affect the cell and the vascular space. So the next time you have a sick patient and they need IV fluids, you can pick which ones are best for them.